Good morning. Good afternoon. It's 12 noon. I'm Feri Naseh, and I'll be hosting our session today. I'm the founder and CEO of Me Time Healing, and our platform has a wonderful mission of providing mental health support and emotional support to those who are in need anywhere and everywhere in globally. And I have today with me Dr. Swati Chanani, who will be talking about a little bit of stress, what causes stress, stress management, and what leads to burnout. So, hello, doctor. Would you like to introduce yourself?
Yeah, hi Feri. Thanks so much for having me. My name is Swati Chanani. I am a psychiatrist. I specialize in working with children, adolescents, and young adults. I spend a lot of time also doing teaching and working with medical students, residents, and fellows. I see a lot of stress and burnout, especially related to the workplace. So I'm really happy to be here to talk about that today.
So, just dive in. What is burnout?
Yeah.
Everybody talks about burnout. It's a hot topic. What is it exactly?
Yeah, it's a great question, right? I think it's a term that's used, thrown out a lot. When we talk about burnout, we're really talking about something that is sustained and persistent, right? So sustained and persistent fatigue, demoralization, and depersonalization. Those are some big words. Feeling really fatigued, exhausted, just not being able to have enough energy to do workplace tasks or even take care of yourself. Right? Depersonalization, where you're feeling really isolated and withdrawn. You're isolating from coworkers, you're isolating from friends and family, you're isolating from your activities. And demoralization, where you're feeling hopeless, you're not seeing any kind of point or mission to what you're doing, you're not getting any joy or productivity out of the work you do. So those are kind of like the three things that we think of as what defines burnout. And it really is, a sustained, persistent thing where day in, day out, this is how you're feeling at work.
And do you see this very common in your practice?
Super common, so both in my practice and just kind of nationally, this is very common. Just in 2024, there are several organizations that were studying burnout, and kind of numbers of these are self-report kind of surveys on how common this is. Numbers ranged anywhere from 40% to 70%. Like Deloitte did a study in which workers, 70% of them reported feeling burned out. So this is very common, and actually very common amongst young people who are just entering the workplace. So it's not just these are the older people who are close to retirement. This is really, really common for our young folks who are, they went through high school, college during the pandemic. They're really excited to join the workplace, and then all of these factors are hitting them that's leading to burnout.
How common is burnout in professional life and in personal life?
Yeah.
Or overall, how common is it?
Yeah. So, I think in professional settings, again, I would say about half of employees feel this way at some point during their career. So it's pretty high. That's a pretty remarkable number. And I think, kind of personal burnout, feeling burned out with all the personal obligations, I would say it's also pretty high, probably 50 to 60% of people. And this is
That's
actually
very high.
Very high. And this is going up. When you look at numbers from 20 years ago, they were more 20, 30%. People study these things over time. It's becoming much, much more common.
So do you see that it's after the pandemic, the statistics have gone up? Yeah.
Definitely. Unfortunately, with a lot of kind of things in mental health, things have become harder after the pandemic, and definitely burnout is one of them.
So how common, I'm sorry, what are the common signs of burnout?
Yeah, so I think things that you should look out for in yourself, or if you notice these in like a coworker or friend, that could signal, this isn't just normal stress or something. This is burnout. When people are losing their productivity, right? So someone who is usually an excellent at their job, really on top of things, they're becoming less and less productive, right? Maybe slower to respond to things. The quality of their work is slipping. They're not doing as good of a job, right? Something's probably going on there that could signal burnout. Another common sign is someone who, they seem less connected to their work. So they seem, more jaded, more pessimistic. They don't like the way they're talking about work is just they're more pessimistic, they're more cynical. They've lost kind of that joy and that mission that they had when they started working. That's another common sign. Um, they also just feel tired. So they're feeling tired all the time. They're feeling fatigued all the time. Not just, one day, okay, you didn't get good sleep, so you feel tired, but they're tired, they're fatigued, they feel like they're dragging their feet. They maybe look tired and look sleepy. They're falling asleep during meetings. That's a sign. If someone who's normally pretty social starts to withdraw, right? So if normally, let's say this is someone who organizes social activities or goes to lunch with other people, and now they're not, they're just kind of isolating to themselves. And then definitely if they're isolating from family, right? So if someone, and friends, so if they're isolating from loved ones, that's a huge red flag for
Wow.
burnout.
Yeah.
Um,
So, how can an individual manage their level of stress and which leads to burnout? What
yeah,
would be your main suggestions
yeah,
at,
and yeah,
at work and personally?
yeah. And that, like, that pathway from stress to burnout is so common, right? Stress is like an everyday part of life and we all feel it. When you're
Mhm.
starting to feel stress day in and day out, that's when burnout is going to start to develop. Um,
Yeah.
and so, like, the things you can do as an individual are, what we say for stress management is take care of yourself. So find ways to relax and unwind. And what that is different for every person. For some people, that's exercise. For some people, that's listening to music. Some people, that's watching TV. Some people, that's spending time with friends. But those things are actually really, really important. They're not just like extra add-ons if you have free time. Those are important things to take care of yourself. So carving out time proactively to do the things you enjoy.
Yeah.
And then ideally, that's like something you do on your own and then something you enjoy doing with other people. So those are really important things, taking
And
care.
hobbies like take on some dance classes, take on some music classes. Music is very healing. I'm taking dance classes myself. I love it. So yeah, finding carving time for yourself is definitely one of the suggestions that I will take with the heart and will definitely follow your suggestion. So what can organizations, and small, medium, large, doesn't matter, what can organizations do for their teams and for their members to prevent stress and burnout eventually?
Yeah, and this is like really important because it's also on like the organization, right? So supporting policies that support people being able to take care of themselves, right? So having good time off and good vacation policies, having good time off policies for sick days or family care days, so those things don't lead to extra stress and burnout. Having policies that support the ability for someone to take time for their mental health. So both like insurance coverage for mental health services, as well as like time off for mental health services. Um, having very clear policies on like workflow, whose roles are what, and having enough staff, right? I think being understaffed is a big thing that leads to like to burnout. So really making sure you have enough staff to support your employees and what they need to do.
And
Um,
then it should be part of the employee package. I believe it needs to be tailored in there, right?
Yeah, 100%, right? Yeah, it needs to be part of the culture. So, yeah.
And so, what do you see again in your own practice when you get feedback from your patients? what helps them, what when they come back to you and say, well, I tried this and I tried that, and I see tremendous amount of improvement. So well, what kind of feedback do you get from your patients after they follow your suggestions and they come back and say, hey, doctor, I tried this and I had really positive results. So what are those? Share those personal experiences with us so we can take advantage of it.
Yeah, and that, what I hear from patients is that really, like, yeah, engaging in hobbies, engaging in social activities, spending time with their friends, that those things really help.
Mhm.
Sometimes things like just managing that balance between work and personal life, right? So, like, maybe it's like, you reduce your hours a little bit, or like you don't check email on weekends, right? Like, those putting forth those kinds of boundaries to have a good work-life balance. I get a lot of help, like feedback, like that's so helpful. Um, and if someone's really struggling, I often encourage them to like talk with their colleagues and talk with their boss, and I always get good feedback on as hard as those conversations are to have, that having them always pays off. And so talking to people, letting them know when you need extra support, I get really good feedback on that.
Yeah, communication is power. The more you communicate what you feel, uh, uh, more people will hear you. Squeaky wheel gets oil. Uh, so at this point, I kind of want to, ask you to wrap it up. Maybe tell me a little bit again about, healthy stress and unhealthy stress, because we also hear about healthy level of stress, and um, it boosts the productivity sometimes.
Yeah.
And as a business owner myself, my eyes are laser focused on the productivity. So what suggestions would you give to business owners, entrepreneurs, founders, CEOs that are out there uh, to look out for?
Yeah, well, and I think that's like a great distinction, right? There's a healthy amount of stress that needs to exist, right? I almost call it like there's some challenge that needs to exist to life, right? If you are not working at all, if you're not doing anything, then you're gonna feel bored, right? You're gonna end up on the other side of this where you're not feeling bored and you're feeling unmotivated and purposeless because there's not enough of a challenge and a stress, right? People want to be have expectations set of them and be challenged, right? So I would say healthy stress is where you're feeling challenged and excited by those challenges, right? Where you're like,
Mhm.
okay, this is like, yes, there's a lot of problems I have to manage and things I have to solve, but like I feel equipped to do it and I know I can do it and I can talk through it with people and then I'm going to feel very accomplished, right? Versus the like, I have all these things and I feel so overwhelmed and I don't even know where to go and I don't feel equipped to do it, right? So I think that's the distinction. And then as like the person running the business, it's like making sure that, your employees feel equipped to handle the challenges you're giving to them. And so that you're available as a resource and you make yourself say like, hey, if I'm giving you something you don't know how to do, tell me and I'm here to teach you and mentor you as well, right? And
Yeah,
that mentorship can really help change like bad stress into good stress.
yeah, yeah, I agree. So I also want to kind of pivot a little bit and talk about this time of the year, which is the beginning of the academic year, and all the parents and college students and all students around the world. They're shifting gears from summer to fall and getting ready for another academic year. And it's usually a stressful time around our household when our son is going to college. So, what would you suggest, and what would be your professional guidance for those who are going through this this time of the year? Also, there are a lot of people who move from a city to city or from a country to country. We call them expats, and what would be your suggestions for them to manage their level of stress to prevent it from, burnout later on?
Yeah, and it's like, I think the kind of thing that's, like tying all these is transitions, right? It's like all these transitions from for the kid when they go off to college, for the parent when they go off to college, for someone when they move, especially across, across countries. Um, Finding things that are consistent and hanging on to those, right? So when your kid is going off to college or you yourself is going off to college, it's like, okay, what are the things that I'm still going to maintain, right? Like a lot is going to change. My life is going to completely change. But like, if there is like my exercise routine, and if that's what gives me my like, peace, I'm going to maintain that. I'm going to find a way to still exercise and maintain that even through this time where there's a lot of things going on. Or if like my sleep is really important to me, I'm going to make sure to protect my sleep and maintain my sleep through this like
Mhm.
kind of transition time. So, it's like thinking about, okay, what are the things that maintain me? What are the things that are important to me? And keeping that consistent, even if everything else around you is changing, right?
Yeah.
I think that's like a big, big part of it. And then knowing that this is a big transition in your life. So again, thinking back to like kind of that work-life balance, this might be a time where you need a little bit more time off work, right? So like use those vacation days, right? If you're a parent and your kid is going off to college, use some of that time to like to attend to that part of your life, right? Try to reduce like proactively some of your workload. So that's not like a busy time at home and then a busy time at work as well, right? Try to like to split it up a little bit.
Great suggestion. Thank you.
Yeah.
Now, how about increasing the level of self-compassion? Would you want to little, talk about that a little bit? And because sometimes, we as parents, especially, we forget about ourselves and we care about everybody around us, and we, forget about the self-compassion. So, what good tools are out there for us to uh, realize and mindfully feel better during these stressful times of the year?
Yeah, and this is so huge. I think self-compassion is really difficult, right? We tend to focus on what we're not doing well and what we're doing wrong instead of focusing on what we're doing well, right? And I
Mhm.
think so much of self-compassion is telling yourself the things you're doing right, giving yourself credit for those things and praising yourself. And I think trying to do that every day, right? Even like waking up every day, telling yourself something you did well the day before. And I actually think mindfulness is a big part of self-compassion. And there's lots of resources out there for mindfulness. MeTime links to a lot of resources for mindfulness. So that's just a quick, easy way
Mhm.
to get some resources. I think mindfulness, that ability to focus on the present and the now in yourself, really improves
Yeah.
self-compassion.
Breathing exercises, I've used them, and I take great advantage of them. It really helps me. Box breathing. And so stress also leads to, as you mentioned, to a lot of other stressors, not just burnout, but, sleep deprivation, insomnia, family relationship issues, sometimes anger, sometimes, phobias, even, like, things start developing due to overstress and due to burnout. So, like you said, when we see these, signs, we really need to do something, right? It's the bell that says, "Hey, ding, ding, ding! It's time to, take care of yourself and find a way to distress." So, in your professional opinion, what are these, specific signs that trigger people from healthy stress to very unhealthy stress, like when you have those moments where you get so moody, and it's in a millisecond you can, your attitude can change. So these little signs that are out there that we can bring to people's attention and say, hey, if you're experiencing these feelings, you really need to start taking care of yourself and have some self-compassion routines.
Yeah. Well,
What would be your suggestion?
yeah, like you're saying, like I think irritability, right? So that quick fuse, if you're finding yourself getting very irritable, getting very easily annoyed by people, that's a sign. If you find yourself isolating from the people you love and care about,
Hmm.
not doing things you normally enjoy doing, or not enjoying the things you normally do. Like, hey, normally I love, sitting and like going to this dance class, and now I don't, right? Like that's a big red flag. Um, and again, if you find that you're really losing productivity, that you can't be as effective as you normally are and as efficient as you normally are, I think that's another sign like, hey, I need to like pause and take care of myself.
Yeah. And for employers, what would be your suggestion? I mean, what should they look for HR managers? What kind of signs should they look for within their organization to prevent, burnout? To talk to their staff members, to talk to their team members, and say, we see these signs, and we want to suggest some, resources for you. And again, communicating, opening those healthy channels of communication. So what kind of signs should they look for within a workplace environment?
Yeah, so I think, if they see a change in employee performance, right? If they see a change in someone and how they're performing at work, right, they should think about it from this angle rather than a punitive angle, right? So, saying, hey, I've noticed that, you're not performing the way I know you normally do. Or if, like, you've been late a lot, like you're not normally late, you're normally
Absentee.
you're right. Yeah, you've been late a lot. You've been taking a lot of time off. I want to make sure you're okay, and how can I help support you, right? So when they notice those things, that sometimes might trigger a knee jerk, like, oh, why are they not doing their job, and like trigger a punitive response. Change that to like a, well, actually, there's maybe something going on. Maybe they're feeling burnt out, and like, how can I help support them and offer them resources?
Yes, and there are a lot of resources out there. I mean, there are, stress management resources like Headspace, Calm, Me Time Healing. We have a mindfulness page with blogs about how to tackle stress. So I believe, having these, resources and providing these resources to your staff members would make a tremendous difference. First of all, they'll appreciate it, right? And second, they would welcome that you are thinking about them and want to help them. So I think it's a wonderful uh, um, approach for the success of your overall, the company and your workplace. So there are a lot of resources out there, again, as we mentioned, but how would you know what is the right resource for that specific person? Do you really need to understand who this person is going through? Do you really need to like dig in and understand? Or what is your professional opinion? Or should you just refer them to a professional and have them, speak to a professional?
Yeah, I think it's like, the right resource is such a, and like that right match is so personal, right? I think if you are coming from the perspective of like a HR manager and employer, I think giving them a wide variety of resources and then letting them explore what's important to them and what's the right match and fit to them. Um, Right, because I think that's such a personal thing that it might be hard for you to assess it. They might take it the wrong way. So I think giving them as many options as possible, not too many where they get overwhelmed, but giving them a good variety of options. And then saying, if you need help exploring them, I'm happy to explore it with you. But often people just like they just need to be pointed in the right direction, and then they can like
Yeah.
explore on their own.
I mean, some people kind of hide their feelings. Like if you're a police officer, you don't want your, superiors to know you're going through, I don't know, sleep deprivation, insomnia, or stress and burnout. and it's very common in that field to feel stressful. So what would you suggest to those who kind of keep it quiet and have that happy face and hide behind those feelings? What would be your suggestion to them?
Yeah, well, and I think it's like partly in those kinds of organizations and those kinds of fields, it's on the organization to try to destigmatize those things, right? To say like we know these are real parts of the job, and we want you to come to us. And if you don't feel comfortable coming to like a supervisor, right, there should be someone they do feel comfortable going to, like a wellness coach or someone who's kind of a safe person to go to for that. Um, or having colleagues that you trust. Like, let's say you just don't work in an organization like that, right? If you've developed a good relationship with a colleague that you trust, kind of opening up to them could be really helpful. And if that's not an option, right, like opening up to your friends and family, and then like trying to be honest and open with them. So like, and that's one thing if you are the friend or family member of someone who's in an organization like that, right? Like knowing this person might be doing a putting on this brave face at work. Every day when they come home, they're exhausted, they're tired, they're irritable. Maybe it's not about me. Maybe it is about work, and they're like brave face they're having to put on at work. And let me try to help talk to them about that.
Yeah, wonderful suggestion. Yeah, I see that a lot in medical industry. Uh, doctors, nurses. It's a very stressful environment, hospitals. So, they, because they're so busy and they kind of feel like, oh, this is not the day to deal with this. I'll deal with this later, and just time goes by, and before you know it, you're hit rock bottom, and you're totally burned out beyond repair. So, what would be your suggestion to your colleagues, doctors and nurses? You're in a hospital setting.
Yeah,
Yeah.
healthcare workers, it's so hard, right? We prioritize taking care of others over ourselves. But it's like, when you're on a plane, it's like the oxygen masks go down. You have to put on yourself before your kid, right? You have to take care of yourself in order to do your job effectively if you're in healthcare. And it's really, really hard. It's really hard to think about it. But like, if you burn out, you're not going to do a good job. You're not going to be able to do your job. So it's also like extra important. And it's again, you sometimes have to like, we're really good at talking to our patients about it and telling them not to stigmatize it. We totally stigmatize it in ourselves, and I think working on that and working on that awareness and just saying, I have to do this. I have to be a good role model, but I have to take care of myself, or I won't be able to do my job.
Well, thank you so much, doctor. It's 12:30 almost, and I want to open the floor for questions and see who has any questions for us. Let's see. Okay. We don't have any questions at this point. Would you like to add anything, doctor, before we wrap up?
I think just like I said, this is, like a really, I think, pertinent, common thing. And it really is, often though it seems hard to take care of yourself, it's just the most important thing, or you won't be able to do anything else. So yeah, Feri, thank you just for inviting me here to talk about this today.
Thank you so much for joining me. I appreciate your time and knowledge. And hopefully we'll have another live session next month, and we'll pick a exciting topic to talk and tackle. Wishing you a wonderful day. And everyone who attended, thank you so much for attending our live session today on LinkedIn. And we appreciate your time and hope to see you guys soon. Have a wonderful day. Take care.